Good morning, everyone. How's everyone doing this morning? Happy Tuesday. I'm so used to saying happy Friday because that's when our healthcare dialogue is, but it's happy Tuesday. I have to think about that. So thank you so much, guys, for being here this morning. It means a lot to us. The healthcare team has had a lot of accomplishments throughout the this past fiscal year. We wanted to show that to you and say that we're proud of the work that we're doing and all the support that you guys have given us. But before we get started, I do want to share just a little bit about me. My name is Robert Martinez. I am the healthcare administrator, and just a little story to let you know why I'm doing what I do today. Um, I've been a caregiver for my parents. I was a caregiver for my parents for many years. At one point in their lives, I'm the youngest of all the siblings. At one point, my siblings decided, hey, you know what? We're going to put our parents in a nursing home. As the youngest, I said, no, we're not. I moved back to my hometown of Gonzales, which is not too far from here, and was responsible for my parents for about a little over 20 years. But it got to the point to where I was working full time, taking care of my parents, doing the best that I could. My dad's health started to decline. My mom would call me throughout the day, hey, dad had a fall. So I would leave work, rush back home, help him back up, get back to work, and did that for years. Finally got to the point to where when dad had a fall, same routine, went to go pick him up, took him to the ER there in Gonzales. They know us so well, they don't even look at cards, IDs, or anything. They just, hey, Robert, go to bed 4, right? Taking to bed 4. They know us. But that day, our primary care physician, who we've known for like 25 plus years, pulled me aside and said, hey, Robert, we got a problem. I thought it was about my dad. Says, you need more support for your dad than what you can offer. What do you mean? I had no idea what he was talking about. He says, your dad needs to be in a nursing home, which that was the biggest shock to me because I took it as I failed. I failed taking care of my father. So I did. I did. There was a choice of two nursing homes there in Gonzales, and I chose one and admitted my dad. Didn't want to, but I admitted my dad there. I mean, he was okay with it. But I was that type of family member that I was there 5, 6, 7 times a day. I would come in at different times of the day. I was a terror. I would come in and why does he have a dirty shirt on? He has a whole closet full of shirts. Why is my dad barefooted? He has shoes. Why doesn't my dad have his belt on? His pants are falling off. Every day I had something. Finally, the administrator, very proactive, happy go lucky administrator, she got on my nerves. That day I walked in, Mr. Martinez, I need to talk to you. What? What do you want? I wanted to let you know that your dad went on an outing today. On an outing? What is that? Well, they went out and they went to the city park and he fed the ducks. My dad doesn't like ducks. Yeah, he fed the ducks. And then we went to Dairy Queen and we got an ice cream cone at Dairy Queen. And my dad doesn't even like ice cream. He ate ice cream. And now we're back here and he's playing bingo in the activity room. Oh, you're lying now. My dad has never played bingo in his life. So I went to the activity room and there he was playing bingo. I was shocked. I actually started tearing up. I was like, my dad's playing bingo? My dad went to feed the ducks? He's never done that kind of stuff. The administrator, the happy-go-lucky administrator, came up behind me and just said, Robert, says, we need more people like you to be administrators. If you really want to see a change in the system, you have to be the change. So I agreed with her. So at that point, I went back to school, got my degree, went to administrative school, finished that, did my 1,000-hour internship, free work at a long-term care facility, took my state test and my federal test the same day. Nobody told me I couldn't do that, but I did and passed them both. So thank goodness. And now, just maintain the 40 hours of CEUs every 2 years. So that is why I do what I do today, is because of that. And that annoying administrator that kind of put me on the right path, well, I married her. And we'll be celebrating 19 years next month. So thank you. Thank you. So that's how I became to be the administrator because of her. And she will tell you that I was still to this day the most difficult family member she's ever had. But again, I learned from that. I learned from that. So now whenever somebody comes to me with a concern or what have you, I'm thinking, I got this, guys. I understand. I understand where you're coming from. So, because it never feels that somebody always starts off with an apology. Robert, I want to apologize for what I'm about to say. Like, don't let me have it. Let me have it. We'll get this taken care of. So anyway, now that you know a little bit about more about me, want to talk more about our team and the great successes that we've had here. You know, we're so grateful for the first off for the 250 for 250 challenge that benefited interim improvements at the Arc, raised over $66,000. We want to recognize all those residents who graciously participated. I also want to thank the one-time buy committee resident council for their continued donations, as well as Colonel Parker for his continued support. Also, a big thanks to Anna Sweden and Emily Morehouse Esquivel for initiating the 250 by 250 challenge, because that has helped us out tremendously. So thank you guys for doing that. I appreciate that. This fundraiser took a lot of work to make happen, and the healthcare team is very appreciative for this event. We have already begun investing the funds raised through the initiative. A percentage has been used to enhance our memory care, including the removal of a wall to create a more open and welcoming living space. We also added new windows so that the residents can enjoy more natural light and better views of the outdoors, along with new artwork to create a warmer, more engaging environment. We also plan to use a portion of the funds to purchase new beds and mattresses, providing greater care comfort for our residents while supporting the delivery of high quality care. In addition, we intend to purchase additional walkie-talkies to improve communication among the care team, helping staff respond more efficiently and coordinate resident care more effective. And I'm not a professional photographer, so I did take some, oh, I'm sorry, before that, for the photography, just a little housekeeping rule, please. If you could put your phone on silence, and we will have a period of question and answers at the end of the presentation. Just, I couldn't do the work justice, you know, but the beautiful paint, the beautiful artwork that Debbie and Lori picked out for us, the windows at the Oaks, beautiful. You can just go up and you can look at the birds that are actually eating out of the bird feeders. Is just amazing. So it just looks very, very good back there. If you hadn't had the opportunity to go visit, please take a minute to do that. It's awesome. And of course, our beautiful healthcare team. Thank you. Thank you. All right, so the agenda for today's presentation is basically we're going to do some highlights from the healthcare department, focusing on fiscal year successes and accomplishments. And this will be the order that we're going to be doing our presentation. And we will go ahead and start with our Elena Jackson.
Oh, too many. Good morning, everybody. My name is Arlena Jackson. I know many of your smiling faces this morning, so thank you for joining us today. But I am the registered dietitian and nutrition care manager for the community and healthcare. But we wanted to focus on pretty much this past fiscal year. Naturally, I may get into other areas of living of where I support healthcare, assisted living, independent living, and then some other initiatives as well. But we've had some priorities this year, and that would be providing high quality clinical nutrition care, improving resident dining experience, and expanding opportunities for resident wellness through education and IDT or interdisciplinary collaboration with the team you see here in the front row. One of the highlights that I wanted to expand on this year is wellness programming. So we have hosted 12 monthly teaching kitchens or resident engagements in collaboration with culinary and activities. If any of you are active on the Army Residence page or LinkedIn, Facebook, I post a lot of our engagements on there, so thank you for following. But I love showcasing exactly what we do and what makes our community unique. But the residents do get to have interactive experiences to where it's not just education, it's kind of a cooking experience. So if you've done the independent living teaching kitchens, we take that to healthcare and assisted living to where it is a hands-on demonstration. So the residents get to partake in sampling recipes, asking questions, and having little nutrition tidbits of education. And it's really nice to see that resident engagement continue to grow. And I know Alexis, Cassie will expand on that as well. For our clinical nutrition excellence, So kind of some foreshadowing as well. So when David gets to his part of this presentation, you'll see how many MDS sets that he does submit to Medicare. So each one of those MDS sets, each one of us have about 1 to 3 assessments that we have to do. And when you see that number, just think of 1 to 3 assessments per MDS set. Oh my goodness. So you'll see that number, and it's a lot of effort and everything that we put in to take care of our residents. But some comprehensive assessments that are in regards to nutrition, it may be significant weight changes, often unfortunately weight loss with that population in healthcare, malnutrition risk, complex medical conditions, those requiring enteral nutrition or peg tube feedings. This is really a team effort. Nutrition's a team effort. We work closely every day with nursing, therapy, hospice, any other providers, family members, and dining services to optimize our outcomes. For quality improvement and survey readiness, this is an everyday culture. So you've probably heard us recently that we are in state window survey, survey readiness. We have to be ready if state walks in today, but this is an everyday culture and mindset. So throughout the year, we participate in monthly QAPI meetings to discuss any performance improvement plans, any outcomes that we're working on together as a team. We monitor residents who are a high nutrition risk every single week. That's significant weight changes, completing monthly or weekly meal observations, sanitation audits, nourishment room inspections, and meal accuracy audits. And that's to ensure safety sanitation within all of our kitchens here in the community. For workforce development, we have several partnerships with a couple different internship programs. So that's UTSA Coordinated Program in Dietetics, the Army Baylor Graduate Program in Nutrition, and the Young Women's Leadership Academy. That last one actually is a new partnership, and I had that opportunity to have Georgia with me a couple months ago, beginning of summer. And actually today I have La Cassidy with me and Marquita, so they're in the second row over here. But they are with the Army Baylor program or master's program in nutrition. Their first day is today. So thank you for that welcome. But we provide hands-on training in clinical nutrition, long-term care regulations, interdisciplinary care, food service management, and survey readiness. So they'll just jump in and start learning by observation and hands-on practice. For innovation and interdisciplinary collaboration, we continue to have programs and initiatives like Puree with Purpose, Everyday Superfoods, which we do partner with the teaching kitchens, and Fresh Benefits, hopefully. So that's more of a fortified food program. If a resident's not eating well, we need to maintain weight. So hopefully I'll do that this coming fiscal year 2027. And our professional leadership and community recognition. I just wanted to highlight this. This is community round, not just necessarily healthcare, but we've had some great marketing this year. Many of you probably have seen the videos, maybe on the local news channels. So I was featured. I had the opportunity to be featured in one of them. I know Carrie's done one, and those continue actually to show on the news programs as well. But that was fun to highlight exactly what we offer you here in the community. 2 years ago, I did have the opportunity to speak at Today's Dietitian over interdisciplinary care that we provide to our residents. I used specific case studies here and the outcomes that we had created for the residents. But just recently, this fiscal year, I had the opportunity to present that same presentation, but as a webinar for continuing education. So it was really nice to highlight each and everything that we do here for our residents. But thank you so much. I'm going to actually turn it over to Faye.
My name is Faye Mingilian, and I am the Director of Nurses in Healthcare. Um, my main responsibilities are clinical oversight. I just have to ensure residents receive appropriate evidence-based nursing care and that changes in condition are promptly assessed and addressed. Staff leadership, we recruit, supervise, I mentor, I schedule and evaluate nursing staff. Also, regulatory compliance. I ensure compliance with federal, state, and local regulations, including CMS requirements in skilled nursing facilities, and maintain survey readiness. Quality improvement, monitor quality indicators such as falls, pressure injuries, infections, medication errors, hospital readmissions, and implement improvement plans. Medication and treatment oversight. Ensure medications and treatment are administered safely and according to physician orders. Risk management, investigate incidents, implement corrective actions, and promote resident safety, and a lot more. I have Kathleen here. Kathleen is our clinical nurse specialist.
Yes.
I didn't follow the instructions. I only tell you the instructions, but not follow.
Okay. There you go. This one right here. Okay. So it's on the second page already. So the first page is. Oh, okay. All right. Thank you for the wait. Hi, I'm Kathleen. I'm the clinical nurse manager, specialist for healthcare. I've been working in the ARC for 8 years now. I've been a nurse for 15 years. That's a very long time. And 12, 13 years in a long term facility or nursing home. Okay. One of the nursing highlights or success that we have in healthcare that we're very proud of is to maintain zero facility acquired pressure injuries for over two consecutive years. It's an achievement that is uncommon in skilled nursing facilities and contributed to maintaining strong CMS quality measures and star rating performance. So, pressure injury, if you have it in your facility, it can directly affect your star rating and your quality measures. So this is why we're very proud of, and this is part of why we have 5-star rating right now. And also, I say it is uncommon because nursing home residents are high risk population. A lot of them have mobility issues, comorbidities, chronic illnesses like diabetes, circulation problem, and also fracture. They come in here right for that. Another success would be we built a successful wound prevention program that eliminated the need for outside wound care physicians for 2 years. Also uncommon for nursing homes because most of the nursing home they rely on outside wound group to do care and assess patients or residents, but we do it internally because we've maintained few chronic wounds over the past 2 years. We've maintained less complicated wounds and make sure it doesn't get worse for us to require physician visits. And another thing that
is success is we reduce wound care supply cost. We did it by partnering with a wound supplier that uses Medicare Part B. That way, our residents doesn't have to pay out-of-pocket cost when they have wounds. Another benefit to it is the facility does not have to pay out of pocket or order wound supplies for residents who have Part D Medicares. All right, and okay, successfully reduced the number of residents with indwelling urinary catheters. So we implemented a routine voiding trial and individualized bladder management plans, improving resident independence and positively impacting CMS quality measure and star ratings. Another thing that affects our 5-star is Foley catheters. So CMS only recognizes 2 diagnoses for urinary catheter, which is urinary obstruction or obstructive uropathy and neurogenic bladders. A lot of what we see is we receive residents from hospital with indwelling urinary catheter without proper diagnosis. So we developed a protocol for us to like reduce number of use of indwelling Foley catheters by doing voiding trials, eliminating the cause of urinary retention. We'll find out why are they on a Foley cath, why are they not urinating on their own. And so we first is we eliminate infection. We eliminate possible obstruction, like, BPH can cause urinary retraction. So we send them to urologists. If everything fails, then for us to avoid that, we need to get a proper diagnosis, which is given to us by our medical director or the urologist. The next one would be performed all IV insertion and manage IV fluid and IV antibiotic therapy in-house. So it eliminates the need for costly third-party IV company, providing faster treatment, reducing avoidable hospitalization, and saving the facility significant expenses. All right, I say significant because one visit for an IV, just to visit, is $165 when they come, just to see you. And if they have to put an IV on you, they're gonna charge you another $565 to put an IV. Yes. After hours is another $165 on top of the visit, as well as a weekend. So for the past year, I guess I have personally done 74 IV insertion. So that helps us a lot, and also the residents, because if we have to get a third party company to do an IV, we have to wait for them to come in, and sometimes it takes 12 hours to a day, and they charge so much because they know it's an emergency. You have to have an IV access. That means they need fluids, they need antibiotics, and if they don't, then they go to the hospital. So, and the last one is reviewed weekly lab results and monitored trends to identify changes before residents show clinical symptoms. So weekly, we do our labs. That helps us see trend before something else, happens. Like sometimes your blood shows something wrong before your body does. You don't know sometimes that you have infection, but your lab shows that you have. So before you get to the part where you are have the complications, we are able to see the trend, the changes, and we are able to take actions before that happens. So it allows us for early intervention, preventing complications, and reducing unnecessary hospital transfers as well. And the next, thank you so much. And the next one would be Jerome, our healthcare resource coordinator.
Alrighty.
Thank you, everyone. Thank you for joining us today. My name is Jerome Celisana. I think some of you knows me already in healthcare. Uh, So my role as a healthcare, my role as a healthcare resource coordinator, uh, I act as the central operational hub for our facility. Uh, my role is vital for maintaining smooth workflows, guaranteeing optimal care for our residents, and providing direct support to our nursing and administrative teams. So, see, I got like few lists in here. So, I am responsible for the following: supplies, equipment, over-the-counter ordering, inventory management. I do also quality control, staffing and schedule management, which is quite challenging. Roster maintenance, shift management, payroll prep, of course, uh, healthcare, medical, transportation, and also companion coordination with the help of John Steiner. Of course, logistics and room readiness and admissions once you come on healthcare. Next is so this is just an highlight of what healthcare resource coordinator impact. For the annual, we actually save 46,230 and 48. Uh, Actual saving achieved for annual is 12,309 and 48. That increases in savings growth and 471%. And also, we have 16 plus cost saving initiatives completed. Uh, this improved our purchasing efficiency and also supported our quality for our resident care. This success, of course, achieved through the teamwork with our Debbie. Debbie, thank you for the support. Uh, Also, for supported bariatric bed and oxygen equipment. Thank you for Anna Sweden and her team, uh, who supported, of course, purchasing and help eliminate rental expenses for healthcare. And clinical and operational teams also assisted with identifying needs and opportunities. So that's what my role is as a healthcare resource coordinator. Thank you, everyone. So I'm gonna give the next one to Janet, our MDS coordinator.
Good morning. Oh, I already messed it up. Yeah, there it is. Yes. Okay. So I will hold my page. Okay. My name is Janet Jauregui, and I've been in the company for almost 2 years. And this is a quite experience for me. I've been a nurse for 7 years, and I work in different segments before coming here. Part of my job is MDS, nurse coordinator. It's a little bit different than the role that David does on the facility. As Arlie was explaining, every time that we have a resident, we need to complete an MDS assessment. Sometimes it sounds confused, but for my part, we have to make sure that every resident that we admitted have the proper and all the documentation according to the regulations. So I'm going to explain a little bit what were the numbers that we accomplished during the past fiscal year. Okay. For admissions from July from last year to June to this year, we have a total for 124 admissions. This is a broad admission. That means that the resident came to the facility and it's been probably been years or more than 60 days is the last time that they were here. Also, we have 11 respite residents. As you may know, sometimes with the resident or a family member from the community need a stay a few days away from the hospital, we provide also that service. We have the all the facility and the resources to take care of the residents if they need to take the medications, they're confused, or they only stay for a few days for antibiotics by IV or another supplies that they need. For a total of 62 residents that were a scale. We also manage different insurance company, as you may know, other than Medicare, we have TRICARE and another private insurance. And also, we have several residents that were in a need to be transferred to the hospital to receive more treatment. We also have residents that they were transferred to another facility and they came back to us. So all discounts are readmissions. That means they were here, but now we need to review the whole clinicals, if there are any changes, new medications, new treatment, or new other specialist appointments that they may need. Every time that we have a admission, that's what we call, we need to perform a full assessment. So, as many as you may visit our facility, every time that you came to the facility, we need to make sure that you have all the consents to receive the treatment, the medications. I know that at the beginning it sounds like why I'm here and I need to sign all this paper. It's all requirement. We understand that sometimes that you don't feel well, and we can wait a few days, but unfortunately, all this paperwork has to be complete. We can work in your piece and until it's finished. So the assessments that we need to complete regular, there are 5. So if we multiply 124 by 5 assessments that we need to complete in every residence, it looks like a big number, but it has to be completed. Okay. Also, we have to follow the regulations for a care plan. Every time that we receive a resident, we take a time to meet with the family, with the resident, to clarify what are the needs for this residents and what is the expected goal for this resident. We have a whole team, John for therapy, Arlie for dietitian, and Deborah for social worker. We need to make sure during this care plan meeting that the resident is they have the clear point that we're expecting results for during the state. Also, at the end of all this work that we develop as a team, David has to submit all the information. So that's basically what we do. And I will explain a little bit the discharge, but it's similar. The numbers you can see it here from July, from last year to June. We have a total of discharges 175. Unfortunately, we had 27 residents that expired during the service. Most of the service were during hospice stay. We also have 35 successful return to home in a total of 113. This discharges complete by another facility. They were the choice. I think we only have 2 residents that decide to transfer to another facility. And we also have residents that they go back to independent living, the Courage, or Lakeside. And that's all the information that I have. Is David?
Thank you. Which way do you press it? Okay. Hello, everyone. My name is David Carnahan. I've been at the ARC for about 3 years now, and I share MDS responsibilities with Janet as well as the entire interdisciplinary team. We all have a part in it. So I'm going to go over just a few of the highlights from us. Um, Real quick, I will explain MDS. Y'all hear it a lot. What is it? What does it stand for? It stands for Minimum Data Set, which doesn't tell you anything. So it's basically a standardized comprehensive assessment tool, and it's created by CMS, who is the ones that regulate any type of skilled nursing slash nursing homes. And they use it to, it's a guide for resident care, and also it complies with all the regulatory reporting requirements we have. Um, so in our last fiscal year, we completed a total of 746 assessments. And as everyone's kind of mentioned before, these assessments, it's one is equal to, you know, probably 8 to 10 hours of work between all of us. So it is quite it's quite a bit of work, and it is challenging for to complete, but it's good. It gives us a good tool to use to help better our care. We've averaged about 30 skilled residents a day for the last year. Our nursing facility was recognized by the U.S. News and World Report as one of the 2026 best nursing homes in the U.S., as well as San Antonio. In San Antonio, I believe we were second out of 101 facilities, so that's pretty awesome. And then, as we mentioned before, CMS, Center for Medicare and Medicaid Services, our overall rating is 5 out of 5 stars. That's important. So, and next up is our Assistant Director of Nursing, Enrique.
Thank you. Thank you, David. My name is Enrique de Luna. I'm the Assistant Director of Nurses. In addition to supporting our Director of Nurses and healthcare and all our nursing staff, I do, I'm responsible for, oh, I said, you told me that? There. In addition to that, I have to ensure that any of the staff, licensed staff, they are current. Their licenses are current. But not only that, also that they are competent. They're competent to make sure that they provide the care that they're supposed to get. The licensed nurses, the competencies are including to even how to put a catheter and have the right diagnosis for the catheter, how to input the orders on our systems. Treatments, medication administration, all of that. Also, all the staff, nursing staff that is caring for you are licensed. They have the proper also certification for providing the personal care that you may require for doing over there in healthcare. So it's the training, training or competency checks are done on hire and as needed and yearly. So it takes a lot of hours to making sure that every day we do check with them to make sure that they're doing the proper care for you all. It's as simple as knocking on the doors before they enter their rooms, announcing themselves, telling you what they're going to provide, what kind of care they're providing to you. So that's very important. Another thing is that being certified, CPR certified, that ensures that if you have a need to have the provider cardiopulmonary resuscitation, they're able to do it properly. There's a certification that staff needs to know that if you require that, we will go ahead and provide it. Just since February of this year to May, we have done about 80 staff members. In addition, those only like other departments, actually. Independent living, some other managers also were certified, CPR certified, independent living, assisted living, and healthcare. On healthcare, we're required actually to have a CPR certification. That's part of our hiring process. Also, mandatory services. There's several mandatory services that we have to comply with as licensed nurses. Working in healthcare, we are required to have at least 12 hours of uh, in services, and they're very specific what kind of in service we need to accomplish. And one of the things too as well, because I'm the infection control preventionist, is that I coordinate all the flu and pneumonia vaccines for our residents. On our mission, there's another thing too as well. I want to make sure that we offer pneumonia vaccine. That's a requirement from CMS that we will offer it. You don't have to take it, but we'll have to offer it. The flu vaccine, if you are current on that, as well as a weekly report to the state on the COVID vaccines. It's still there, even though we know that it's like nobody talks about it anymore, but it's still there. We have to report that weekly to the state. How many people have done or have been offered the COVID vaccine? How many people have done or offered the flu vaccine and the pneumonia? Okay. Our next speaker is Alexis and Cassie Aguilera. Okay.
Okay, good morning. Hello. Thank you all for being here. I'm Alexis. I am the Activities Director for Healthcare as well as Crestway Assisted Living.
And I'm Cassie Aguilera, and I'm the Activities Director for the Oaks.
So today we're just going to go over some highlights for activities in the past year and just discuss the ways in which we've worked hard to make sure residents are happy, healthy, and working towards their goals through recreation. So in the past year for daily programming, we've had about 1,205 activities, averaging about 100 monthly. Every week, of course, we cover all 7 dimensions of wellness. There's availability for activities outside of scheduled groups just to make sure everyone has something at all times, keeping them happy. As well as weekend activity programming. We've had more participation in weekend activity programming recently, which has been really great to see. And then in the Oaks, I know we kind of touched on it in the beginning, but there's been decor enhancements, additional windows just to bring in natural light and really beautiful views. And I'll just say it again, if you haven't been, it's really nice if you can go and see it. Resident participation rate. Compared to last year, there's been a 70% increase in participation rate across all levels of care and activities. There's been an increase of about 47% within residents who typically would remain in their room for various reasons. So seeing them participate more in different ways, whether that's coming to groups more often or individualized activities that I do. And then a little bit more about the individualized engagement. I do one-to-one bedside and in-room activities weekly for residents that need it. Daily visits, just checking in on everyone, making sure that they are provided anything that they might want and meets their needs and preferences. And then, of course, using therapeutic tools and methods to modify activities, whether that's in group or in room, to make sure everybody can participate in a way that's comfortable for them. And then community partnerships. So I've had a lot of groups and individuals that have come to volunteer, and it has been such a blessing and so helpful to have, and it's good for the residents to see new faces and see old friends. So some of those partnerships include the Archangels, the Ark Protestant Chapel Service, our therapy dogs and animal visits, various live musicians, elementary school students coming to visit, independent ARC residents coming down on their own, outside volunteers, and then multiple hospice groups have also come to help. So very grateful for all of them.
And then the larger special events and celebrations, We've had monthly birthday celebrations, America's 250th celebration, um, Father's Day bowling and donuts. We've had our, yeah, teaching kitchen, Mother's Day tea party, our Cinco de Mayo, can't forget that, fiesta barbecue, crafts with students from local daycares. We've also had our Mardi Gras parades, our Valentine's Day parties, and our New Year's party and games, 12 days of Christmas, Veterans Day ceremony, and Halloween parade, our summer luau party.
Just okay, thank you so much. We'll pass it over to our social worker, Deborah Settles.
Hello, everyone. Good morning. I am Deborah Settles, the social worker in healthcare. And when needed, I also go over to assisted living, Lakeside and Crestway. I have been here at the ARC for 5 years. And some of the numbers that I wanted to share, I'll share some of the numbers in just a second, but, oh, wrong way. Thought it was, there we go. Okay, as a social worker here in healthcare, I have maintained 100% compliance with the CMS and state social services requirements, contributed to the facility's 5-star CMS quality rating through survey preparedness and resident advocacy, no deficiencies related to social services. We had no unresolved grievances and completed MDS timely. The resident exit surveys have been completed and have had positive outcomes. And when everyone gives you their information from dietary, from MDSs, from nursing, from activities, I'm a part of every single one of those processes. There is no care plan that happens that I'm not a part of. The MDSs, I have 6 sections in each MDS for each resident that has to be done. So that number, 700 and whatever it was, multiplied by 6 sections, it's a long, very long, tedious process to get all of these things done. I'm a part of every admission that comes into the facility, paperwork, assessments, and all of the things that go with that. I'm a part of every discharge plan that when a resident leaves, and all the meetings, all of the family gatherings, all of the things, part of all of those as well. And I've been here for 5 years, and I just wanted to share the increase, the numbers that we have in healthcare that we have increased over the past 5 years. When I got here in 2021, I started on February the 23rd, and in our healthcare building, we had 6 skilled residents at that time. And in July, we increased it to 10, and by December 1st, we were at 11, and this is in 2021. And as you can see, we've slowly increased our numbers over the last 5 years. In 2022, in July, we had 15. In December, we had 14, and both of these years, 2021 and 2022, we had no TRICARE residents at all. We were just dealing with Medicare services. And in 2023, we got Faye, who is our director of nursing, who introduced us to TRICARE. And we started utilizing a different insurance for the residents that needed more care, more therapy. So in 2023, in July, we had 15 skilled total, but we had 10 Medicare and 5 TRICARE. In December, the 17 Medicare and 8 TRICARE, so 25 total. So you can see the slow progression that we've had, the increases over the last 5 years. And July 1st of this year, we had 27, but I don't know if it was March or April, we had the highest number we've ever had. I think it was 36. So to say that healthcare has experienced an increase is an understatement. The amount of the workload that it takes us to do the same thing that we did back at 5 years ago when I first started working here is tremendous. And we are grateful for the team that we have because it takes each and every one of us to accomplish what we do on a daily basis and work together to get all of the residents taken care of and to follow all of the processes that we have to do as the interdisciplinary team for the residents that we have. And just an overall, view, like I said, as part of every person that comes into healthcare, I am part of the admissions and part of the discharges, and it just, all of these things are just normal everyday processes that we do in healthcare, but the numbers are large compared to other facilities and other buildings having 30, an average of 30 skilled residents is quite unheard of in long-term care. It just doesn't happen. So we are extraordinarily good at what we do in healthcare, and that is a large part to all of our team members. And the next person that you're going to hear from is Diana Lorenzo.
Hello, I'm Diana Lorenzo, and I'm an admissions and healthcare office assistant. This year, I've reduced admission process time from 4 hours to 90 minutes. Since the beginning of January 2026, we've had a total of 56 admissions. I've had the help with hospice contacts at Northeast Methodist. I have 17 contacts with the case managers. At North Central Baptist, I have 5 contacts, and at BAMC, I have 20 case manager contacts. We have successfully coordinated over 300 admissions, which helped increase the facility occupancy from 88% to 95% through referral coordinations and assisting. I also do long-term care insurance reimbursement submissions. I'm assisting 25 residents right now. I am working with John Hancock, Genworth, CNA, and Mutual of Omaha. Those just a little bit of the companies that I submit reimbursements, and successfully all of our residents right now have got reimbursed monthly. I'm gonna pass this on to Rachel. Sorry.
Okay, am I moving up or down? Okay. So hi, my name is Rachel Perez. I'm the Lakeside Assistant Living Manager, and then I'm also interim for Crestway right now as well. So I just wanted to talk about some of the achievements that we have at the assistant living. Ah, okay. So one of our greatest accomplishments is we've improved staff stability, reducing staff turnover through improved communication, consistent leadership, resulting in better resident care. Consistent staffing does create stronger, dependable team. It creates a stronger and dependable team, and this allows the employees to build a meaningful relationship with our residents and the families. Um, Another thing that we've accomplished is we've enhanced our resident activities. So we've increased residents' participation in daily activities, offering a variety of options, encourage more social interactions and physical wellness activities. Again, we built that relationship when they first come in, so that way we get to learn about the residents and what's their best interest. Another thing that we've worked on is our strong medication management. We've maintained a safe and accurate administration, ensuring timely medication orders and remaining compliant with state regulations. More medications on board, and by strengthening our medication management, that has reduced delays and a lot more coverage. Um, and then I want to go to resident care. So we've strengthened our resident care by improving on teamwork among caregivers, ensuring residents receiving individualized care while maintaining dignity and independence, conducting regular staff education, strengthening collaborations with the physicians, hospice, therapy team, healthcare agencies, home health. So I just want to say, by fostering these strong partnerships with the healthcare professionals, sorry, I'm out of breath. Um, Meaning like Dr. Soria, wound care, home health agencies that we bring into the assisted living, this all overall helps improve the residents' care. And then another thing that we've accomplished is we've improved in your move-in experience. So we understand that moving into the assisted living is one of the most significant transition in a resident's life. So we want to make that process. Our goal has always been to make the process smooth, welcoming, and stress-free. Um, so by doing that, we're coordinating with families on the move-in process to ensure residents have a smooth transition, providing timely updates, answering questions promptly, we've implemented a welcome committee, and that welcome committee is initiated by the residents at Lakeside, just to get the new move-in, comfortable, just encouraging them to come out to dining room services and to participate in different activities. And then staff is educated on definitely their customer service to making the new residents feel welcome and comfortable in their new home. We kind of understand that it's going to take you a while to get familiar with us, with the faces and who's working there. It's a smaller group in the assistant living, so we try our best to accommodate everybody's needs. Thank you. And I think next we have John Steiner.
Okay, thank y'all guys for coming. They saved the last spot for me. I think it was an effort to limit my speaking time as I have a tendency to go on and on. We'll see how that works. I just wanted to go over just a couple of things over the past year that we've kind of done in therapy. Without getting into too much detail, we just purchased and I sent Claire, who is our speech therapist, to a continuing education course. And we have this, and I'm not a speech therapist, so forgive me, but basically it's just an E-stim unit, and I'll let you read through it. But basically it's to kind of specifically target these small muscles for people who have severe swallowing problems. It's called an AMP unit, and I'm not going to get into the science of it because I'm not a speech therapist, but I think that's going to be very, very helpful moving forward, and we can use it in across all settings here at the ARC, inpatient, outpatient, everything. One of the big things, and a lot of this thanks to Debbie, we got a new room this year. We got a lot more room as opposed to the room that we had, and it has been amazing. You know, we're not on top of each other anymore. We're not trying to crawl each other anymore. We can have residents in there, their families in there, and more equipment, and we're just not on top of each other. So that has been a very, very nice change for us. So, and if you haven't seen it, you're welcome to come down. I think I have a picture of it in here. It's been a busy year for, especially the beginning of this year for us in therapy. Most of y'all are probably aware that we transitioned to a new software at the ARC Matrix. In therapy, we transitioned to 2 different softwares at the same time, which was a lot of fun, and trying to learn 2 of them, and then the 2 of them were supposed to connect to each other and talk to each other, and sometimes they did, sometimes they didn't. But we muddled through it and got through it, and it's all starting to work a lot better. So it's going to, the new therapy software is going to be a lot better. It's going to make us more efficient, and it's also going to make us more Medicare compliant. So, as you know, some of the other people have talked about, we've gotten busy down in healthcare, in case anybody knows, especially since I've started. By the way, those who don't know me, I'm in PT. I've been here a little while. Well, I remember having 2 Medicare patients at one time. So we've gotten very, very busy. So this year we've had to expand the therapy team. We've added 2 new full-time therapists, and I want to say we've gotten like 9 new PRN patients that work fairly consistently. And then I've just hired another part-time speech therapist, 20 hours a week, because Claire is so busy with healthcare and outpatient. So as we've gotten busier, we've had to expand. Thanks to the generous donation of a lot of different people, I want to thank everybody who contributed to this, but I've been wanting one of these machines for a long, long time down in rehab, and we finally got one, a new step. So if anybody's worked with those upstairs, you're familiar with them. It's just a great piece of equipment. You can work your upper body, your lower body, your cardiopulmonary system, all in a seated, safe position. The seat rotates 100 or 360 degrees, so it's easy for people to get on, and it is literally from day two probably become our most used piece of equipment in the downstairs therapy gym. So uh, we're really, really happy with that. So this is the new step, some pictures of what it kind of does. I think, if, like I said, if y'all been in the upstairs gym, you've seen it. And then this is just some pictures of our upstairs, or the new gym. As you can see, you know, we've just got so much more space, so much nicer. We can do better patient education because we have room. We can, you know, practice getting up from falls, all sorts of different things. So it's been a really good transition for us. So now the next thing that I want to go over real quick, this is just what we is our functional outcomes, which is really probably one of the more important things that y'all want to know about. Okay, you know, do we get better? Do we get to go home? You know, how does that work? How do we compare with everybody else? Well, I've given this presentation before, but it's always been for a quarter. So this is the first time I've done it for the full year. And all this is very important with our 5-star rating. It also all goes through the MDS, like everyone's talked about. But this is how are we doing with y'all getting better? So what happens is when y'all come in, we do an initial evaluation, PT, OT, speech, and basically Medicare breaks it down into these 3 components, basically, of what are they? Function, mobility, self-care. And all that is basically is, can you dress your upper body? Can you dress your lower body? Can you put your shoes on? Can you feed yourself? Can you brush your teeth? Can you toilet yourself? Can you roll in bed? Can you go from lying down to sitting, sitting to lying, sit to stand? Can you transfer from the bed to the chair, from the chair to the commode? Can you walk 10 feet? Can you walk 50 feet? Can you walk 100 feet? Can you go up and down a step? Can you go down a ramp? Can you go up 12 steps? Those are the type of things that we have to evaluate. And so then when you leave, when you come in, we do all that and we get a score. And at that time, Medicare sends it through their AI bots or whatever. I don't know how they do it, but they basically come up with this expected discharge score. And so this is basically what they have determined. This is what we expect them to be, or expect you to be at discharge. So this is not my number, this is Medicare's number. But it kind of gives us a basis to see how we're doing, okay? So basically, if you look up here on self-care, this middle one, discharge, percentage met. That means that we met the score that Medicare decided that we should be hitting. So for self-care, we hit that goal 78% of the time. For mobility, we hit that goal 78% of the time. And for function, 80.5% of the time. So they're kind of the same, just same numbers, a little easier to see. And these have these are basically the same numbers. It gets into more of what the admit score was, the expected score, and what the actual discharge score was. Well, one of the things that I do want to point up here is average length of stay. Our average length of stay for the year was 56.6 days. Now, I'm not an expert at the length of time. Robert knows more about it than I do, but that's probably about what I would hope that it would be. Now, keep in mind, that includes people who were, you know, already in healthcare. That includes people who are coming from assisted living and, of course, independent living. I don't know exactly how these numbers are broken down, but I would probably think that the people who were in healthcare, their length of stay is probably a little bit longer. The people who are coming from independent living, their length of stay is probably a little bit less if I just had to take an educated guess. But that's for the whole year, all places of living, okay? So, Now, so we've got these scores, and oh yeah, those scores look pretty good, hitting the percentage. But but the main thing is, what does that really mean? How do we compare? So this is where we come in. Again, this is all the scores. But what I want to come over here and look at is, how do we compare? So on our function score for the county, we're 56.5. For the discharge, we're 55.5, and the mobility score 48.4. So basically, we are doing, those are the actual scores. Where are we on the percentages? That's not exactly what I wanted. But anyway, the point is that we are scoring higher than the national, state, and median averages. I don't think that these numbers are exactly. Yeah. Okay. I'm sorry. Yeah. Thank you. This is why I bring him with me everywhere I go. He's the numbers guy. Yeah. We scored an 80. I was going, these numbers don't look right. Yeah. So those are the national averages. So you can see how we compare to the county, the state, and the national. The point is, we are significantly higher in comparison to all those other folks. And so that's really what I wanted y'all to see. And this is, again, over the past, those numbers are combined over the past year. So, those are the functional outcomes. And really, we call them, they're the therapy functional outcomes, but really they're the healthcare outcomes. Because really it's, therapy is just one small portion of it. It's everybody. It's, we can't do what we do without the nutrition. We can't do what we do without the nursing, and it all kind of comes together in those scores. So I just wanted to come out and just say that, these scores are, I guess, validation of what a great healthcare team that we have and how hard we work. And, so, it's all these folks, it's our staff, it's all the nursing, it's maintenance, it's everybody. I guess I better include Debbie and Steve on that, or I'll be in trouble. I'll be called to the principal's office again. But anyway, I'm going to give it back to Robert, and he can open it up for questions and answers.
Thank you, John. Guys, I want to apologize for running over. We just had so much information to give, and we're trying to condense it down. And I started off at, like, I think it's 75 slides, got it down to 30 something slides. So again, I apologize. Do have time for some questions and answers, but we will remain afterwards as well, so that if you guys want to ask us anything individually, we will be more than happy to as well. Do you have any questions now? All right. Oh, yeah.
I'm bringing questions yet, but I just want to recognize this entire team. And as an organization, we're extremely blessed to have folks like this. We don't hear a lot about healthcare. But it is the guts of the facility, and a lot of people come here because of healthcare. And there's so many places closing their healthcare, divesting their healthcare, reducing it. We're getting more and more folks coming here because we embrace and we invest in ours. The leadership with Robert and Faye tried to sneak out, but Faye speaks softly, but she carries a big stick. All right, they do accountability, continuous training. They try to look at the systems, the process, not just one-offs, but how we can make sure the residents are cared for. Arlie, David, data experts, dining experts. Rachel has helped us so much in assisted living with her professionalism, her relation with families. Kathleen, Enrique, all the continuous training, infection control, IVs. A lot of us got trained for CPR and how to run those AEDs. Janet, Deborah working with, and Diana working with data and residents, trying to make sure the data matches what the people actually need. You'd be surprised, you go to places, the data doesn't match the person. And we're extremely good at that. All the day-to-day. Jerome, we call him MacGyver. He's so creative, he solves problems. John, you saw how the therapies almost doubled the outcomes of what's expected. Phenomenal. and that's been earned over many, many years. Our activity professionals, a lot of organizations don't have degreed professionals that lead the recreational program. It's important. It's not just activities, it's getting people to use their body in therapeutic ways. So incredible, and Debbie and all of her help with the healthcare team. We're really blessed to have them. We're touring somebody this morning that doesn't have healthcare at the place they were looking at. This is extremely important. And I just want to thank each and every one of them for all the work that they do. They don't always hear compliments. It's extremely hard, all the data that gets crunched and making sure we're also getting reimbursed for it. They're phenomenal. One of the better teams we could ask for. And Robert, great leadership with you setting the tone and continuing the journey. It's hard for a CEO to see a microphone and not have to say a few words, but I really wanted to congratulate and thank you all.
Thank you, sir. Appreciate that. Thank you very much. But we will stay afterwards, guys. If anybody has any individual questions they want to ask us, we'll be up here in the front. Thank you all so much.